I've left probably the thing that gets me out of bed every day last, which is the healthcare costs. The reason the food system cannot go on as it's going on, I'm still talking about the new fundamentals, by the way, is because of the cost of healthcare. The cost of diet-related diseases to the NHS in this fifth richest country civilization, if that's what we call it, has ever produced, is unsustainable. Think what it does to India. The town I was brought up in, now one of the biggest cities in the world, Bombay, Mumbai, has the highest rates of diabetes type 2 in the world. And it has no NHS. It cannot afford. There it is a disease of the rich. Here it's a disease of the poor. Poor people are fat. Here, in India, rich people are fat. It's a return, in a sense, for us, to the 18th century. You see those big portraits in the National Portrait Gallery of the Henrys. Grotesque. They are making a social statement, you know, much as those of you who know Minoan culture celebrated with the big goddesses. Hugely fat people who undoubtedly died prematurely of cardiovascular infarctions. But they didn't have an NHS to bear the costs, to do the stints and stents. The healthcare costs are bringing the food system to its knees. That is what got the Chancellor, the Treasury, to start thinking about prevention. And that applies here in Britain. Think how much it applies in the United States, where 40 million people don't even have healthcare insurance.